Ruth wouldn't let me introduce her before, but one of the things I do want to say is Ruth has been a tremendous supporter of our trust, a tremendous supporter of mental health and community services, and a personal, she's been very supportive of me. So I'm delighted that Ruth's here to talk this afternoon. So thanks, Ruth.
I need a whizzy. Thank you so much. I love listening to Roy speak. It's just a laugh, but actually really important to listen to his messages. I've really enjoyed speaking to him. We've got an improvement faculty just being set up with. We've had our second meeting, and Roy's part of that. And you can imagine Roy being really challenging to some of the people in the room, and it's just great to see. Because actually, I think I've got huge respect for the guy. I've got just a few slides really, just to say a bit about what NHS Improvement is. It's only just come into being in the 1st of April, and then go into some of the things that are going to be my priorities as the Director of Nursing for NHS Improvement. It doesn't really come off the tongue at the moment because I used to be in the East of England, and somehow I've managed to be in NHS Improvement. I guess the purpose of this slide is to say that it's not just Monitor and TDA that are coming together. So Monitor had all the FTs, and TDA had all of the non-foundation trusts, all the TDA trusts. Actually, it's got all the patient safety from the NHS England as well as other bits. I guess this slide, the last two columns here is that what is in my portfolio and what's in Cathy McLean's, the medical portfolio. So I do have the lead for mental health. For NHSI, and I'm really pleased that I've got that actually. I don't have a mental health qualification or any service experience, but I do have a real passion for it, so I am looking forward to taking that lead. Very different to what Monitor have used to be. Monitor, I don't know whether some of you must have known that Monitor had everybody down into London, so it was very much everybody went to London, even though it's covered the whole of England, everything was in London. NHSI is going to be much more of a regional focus, so there will be a regional presence across those areas. Now this isn't a donut, and it doesn't have patient inside, so please don't go and kill me, but I am going to change this slide as a result of what Roy has just said. So this slide is going to get changed. As he sat there, I thought, oh my God, I wait till I get a look at my slide deck. So you might have seen me looking at some papers, and that was the slide I was looking for. This just tells you some of the areas of responsibility that within it. Professional development. So I went to the Deputies Federation, Deputies Conference in Nursing Times. Anybody there that went to the Deputies Conference? Well, anyway, I'm really keen to do two things about professional development. One, which is to get the network of directors of nursing to be mentors. So every director of nursing will need to be, I hope, I'll get their support, will need to mentor a deputy director of nursing from outside the patch. So where is Andy? He's gone. He's just gone. No, it doesn't matter. I just wanted to make sure he was, so when he comes back in, we'll have to just check that he's actually going to mentor a Deputy Director of Nursing outside the patch, and indeed yourself. I just want to make sure that we've got Directors of Nursing really looking to bring on the next generation of nurse leaders. And the other thing that I guess that I really want to do is to provide people that when they do want to become directors of nursing, that they're fit to be those directors of nursing. So they learn the skills as part of that. Patient experience, we've just got Julia Holding, a really great lady, going to be leading patient experience. And I'm not going to do a patient experience objective. We are going to do this. It's going to be much more about how we use patient experience as part of our everyday work, of our everyday things that we're going to be doing. So I think it's going to be a bit of a different way of a national approach. There won't be a friends and family test approach to patient experience. It's going to be something that we're going to drive as much a part of our integrated way of working. Infection prevention and control. Oh my gosh, this is going well and truly up the agenda. Not just MRSA and C. difficile, it's going massively up the agenda. I think we did some really good work about 5-6 years ago nationally around MRSA, C. difficile. I think we're going to see something over the next 3 or 4 weeks is going to really push that up there. So much so that I'm going to appoint a national infection prevention lead. If any of you in the room are interested in that job, because I haven't got anybody there. it would be good to do. Oh, right, okay, good. Email me later. My email will be at the end, I hope. And if you haven't got it, I'll make sure you've got it. Sorry, I've recruited somebody already. Workforce. I've had the dubious pleasure of doing some work on staffing previously with the NQB guidance. We are about to launch the updated NQB guidance. I've told the HSJ it'll be this month. It may or may not be this month now because it depends on PERDA. Given that we've got 2 elections at the moment, we've got the next one coming up with the referendum. So anyway, it will come out at some sort. So no longer will we have the 10 expectations, but it will be much more focused down to 3, maybe 4 expectations. But there's a fair amount of work that we're going to need to do on workforce policy. We've got a whole load of people working, I've just taken on workforce efficiency, about the agency controls. I mentioned it earlier on my workforce panel. I promise you now that I am talking every time we go to a workforce meeting about it not just being about nurse agency. Because when you get all the figures that are coming up, it all talks about where we are with nurse agency and where are we with the doctor agency figures. There isn't the detail, that's because they're not necessarily having the control over doctor agency and locum agencies I think they need to have nationally. And maybe locally, I don't know, but I just challenge you to start thinking about where you are. Not just with nurse agency. I think the bit that we've been doing some good work in TDA did some work on specialling, about one-to-one specialling, and I know that there's a mental health issue on this as well as in the community. But TDA worked with about 12 trusts to look at specialling, to look at the role of carers in providing some of that care. Now that may not be appropriate all the time for a patient with a mental health serious illness in the time and an acute, but actually we don't necessarily need a registered mental health nurse all the time when we're doing specialling. And actually there's some great work that's been happening around 12 trusts and we'd like to roll that out nationally. So if you're interested to do some of that work, if you're interested in doing some of that learning on specialling, then please just contact me and we can put you forward for the next scheme. Maternity and children's. Maternity doesn't really cover you so much. But Bertie Harle of Lamb, some of you may know Bertie. He used to work for me in east of England. She's now working for me nationally on this. And I think we've got some huge pieces of work to do around staffing. And indeed, you'll know from the task force recommendation about maternity in with new mums and in that space. So I think we've got some big work to do on that. Quality improvement, you won't be surprised to see that I'm going to be looking at pressure ulcers. I've got one through me. I'm a bit like a stick of rock when it comes to a pressure ulcer. But yes, we will be doing some stuff on pressure ulcers. But these are the 4 nursing sensitive indicator stuff that we're going to be doing some work on nationally. Now I could say we're going to be doing a load of work on about a dozen or so things. Actually, we're already in month 2. I want to concentrate on just a few things this year before we roll into something next year. So those are the areas that we'll be looking on. If you want to help me, any of you individually or collectively on any of these pieces of work, then please email me. And I'd love to work with you and colleagues. And if you've got anything about really good great practice, yes, tell the FAB people, because I look at that too. But also email me if you don't mind, because I'm really interested in doing something. We've done a lot on stop the pressure, but actually I think on falls, I don't think we've done enough on falls nationally, but it'd be interesting to see your opinion. Safe and sustainable staffing. So this is the slide that, please don't tweet this slide, because this is the slide that will be, I hope, in the final guidance of the expectations. So it's going to be 3 expectations. It may end up being 4, but at the moment we're into 3. These are the priorities with regard to staffing, and I guess the big one will be about care hours per patient day. At the moment, I've written out to directors of nursing to say that care hours per patient day is just for acute, is part of the Carter, Lord Carter's response to the £22, I only wish it was, £22 billion problem of the efficiency challenge. Care hours per patient day is a way of measuring it. It's based on the nurse hour per patient day out in Australia and New Zealand. We are going to be doing it by registered and by unregistered workforce. by registered nurse workforce, but we're also going to be rolling that out to physios and OTs in the near future as well. So we're really going to try and capture the amount of care that goes into goes to care for a patient. That is still work in progress, big time. We are not where we need to be in terms of rolling that out come late summer, about September-ish time it will come properly rolled out. If any of you are already doing some of this work and you've got any particular interest or expertise, then please talk to me and help me. I'll gratefully receive it. And we will need to be doing that for mental health settings and for community settings. If you want to be pioneering some of that work, then please, great, be good to work with you on that. So we've got Ray Walker from Mersey Health, doing the lead for mental health staffing. We've got the local Oliver Shanley, OBE. Oliver is doing the learning disability. If you want to help us with some of that, please do so, because that'd be really good to do. So the other thing was the you've already done it. Oliver and Ray, and of course, I should have remembered about Crystal Oldham leading the community work. Crystal's the chief exec of the QNI, Queen's Nursing Institute, great lady, and she'll be able to help, I think, do some caseload management work. And again, if you want to be part of that work, just email Crystal or myself. So we are going to appoint, subject to consultation, 2 leads on mental health, and I think we've got some real big lessons to learn from Southern Health. You've probably been watching some of the media issues as much as I have around Southern Health. Really challenged organisation, some great staff, just like there were some great staffs in some other organisations that challenged, but I think we've got some big things to learn from Southern Health. And the biggest thing I'm learning from Southern Health is, remember about 5-6 years ago when we had mid-staffs, we had Basildon around their HSMR, their mortality figures were really off the scale. And indeed, Basildon HSMR was actually higher than mid-staffs at the time. But the public inquiry was in mid-Staffordshire because of one lady only, Julie Bailey. If we had Julie Bailey somewhere different, it would have been a different place. So I'm not blaming mid-staffs at all for any of this, because it could have been at a very different local hospital. But I think we're at that with Southern Health. I think we're at that stage of looking at mortality. So I would urge you, out of the first lessons that I'm learning around Southern Health, is to look at your avoidable deaths, to look at your mortality data in much more detail than perhaps you would have looked at it previously, because that for me is the biggest learning out of Southern Health so far. But I think there'll be other learning that we can do around it, but I think we're going to have a focus on mortality like we did out of mid-staffs with Southern Health. So I'll just plunk that one there for the future. The task force, massive implications. I can't believe we've ended up with 56 recommendations. They're saying there's 5 themes for NHS Improvement, and indeed, even though there's only a handful, we think we've got relevant since 27. So there's further work that we need to do with the task force, and that first meeting is happening next week with Sir Bruce chairing, so it'll be interesting to see. Learning disability, we mustn't forget some of our Winterbourne lessons learned in the learning disability focus. We've got some personal learning from that, and I remember in this patch actually going and doing a CTR, an amazing experience, and I think it was actually some of your team that took me, but it was a CTR, it was an amazing experience, and we must not forget and lose our focus. Even though we're looking at staffing, we're looking at Southern Health, we mustn't lose our focus on learner disabilities as we do that. So, this is the slide with the 2 mental health leads. So what was it for South Essex? I think you might know that your very own chief nurse Andy has been part of our advisory group with Monitor. You might not have known that, but you do. You do now. Oliver and Andy both were advising me and Hugo Massey-Taylor, and we're hoping to continue to do that. So we're taking advice from people like Andy that have my confidence and your confidence to be advising me. And I guess the big thing that we'll need to do is to only intervene where it's necessary. I think we've done quite a lot recently about holding a bit too much grip on the system, and one of the things we really want to do is to move much more to support and only intervene where we absolutely have to, because we won't be able to do that. And I haven't got my email on there, but I will leave it for you. My Twitter handle, you'll see no doubt, is I'll be tweeting when I get access to it. But I would urge you to email me with anything that you think you can help me with. I'm only sort of 5 weeks into post, 4 and a bit weeks into post, so I've still got a massive learning curve. And so if anything that you think that you can offer nationally, then I would really appreciate your help. Thank you very much. Have a great day. Have a great evening. And thank you.
This has been a long day. Hopefully it's been a good day, a great day for people. But the celebrations haven't finished. Many of you in the room have actually won awards, but I can't tell you who they are, so that's an incentive for you to stay. We've caught up some time, which is good. Isn't it? It's good we've caught up some time. My team need 15 minutes to sort this room out because we're going to change some things round. So we're going to have a 15-minute break, and I'm told I've got to order you all out. Nobody can stay in for the next 15 minutes, and it will all come back in to do the award ceremony. Thank you very much.